Hello, welcome to today's Q&A session. My name is Jane Arnott and I'm the General Manager for Consulting and Business Services at Community Business Bureau. And I'm here today with my colleague, Dr. Ellen Schuler, who's one of our business consultants here at CBB and who presented the webinar on quality, compliance and risk.
Hi.
CBB acknowledges the traditional owners of country throughout Australia. We recognise their continuing connection to land, waters and community, and we pay our respects to them and their cultures and to elders past, present and emerging. And we are recording this session in Ghana land. So thank you for watching our NDIS Success sessions and many thanks for your positive feedback. We've received a range of queries via email and we'd like to answer them today. And as with our previous Q&A sessions, we'll try and answer your questions to the best of our knowledge and drawing on our experience of working with NDIS providers from across Australia. But we're not in a position to give legal advice. So if you're unclear or in any doubt, please do check with the NDIS Commission website or call the NDIS Commission helpline. Staff answering the phone there are very helpful, and from our experience they follow up with providers if they can't give you an answer on the spot. So we're going to kick off with our first question, which is in relation to NDIS worker training.
Okay.
So on the webinar you recommended that all staff complete the quality, safety and you module. We also have this worker orientation module. Are they the same thing?
Yes.
Help us understand the terminology.
Yes, absolutely. They are the same thing. So the worker orientation module is actually called Quality, Safety and You. And you can access the module on the NDIS Commission website. You have to individually register for the training session, and at the end you get a certificate of completion for that session. And please, as a provider, please keep a record of your workers who has actually completed the session, because the auditor will looking for evidence that you have completed the session. Nevertheless, if you want to do it in a group session, I think it's actually a good idea to do it in a group session. You can do that too. Just keep a record of who attended the session. Maybe let people individually sign who've been part of the session. And what you could do is actually stop the video occasionally and do a little bit of, do exercises, do question and answers, and make it an interactive training.
Yeah.
Also, if you are an unregistered provider, you're not required to do the training, but it is actually a really, really good training module, and we actually really recommend that any provider and any worker completes this training module. There is additional training available free of charge. NDIS, for instance, the peak body of disability service providers, they have really good free modules. They have training on zero tolerance, preventing abuse and neglect. As I said, they are free of charge and they are highly recommended for providers. They also have training on cultural sensitivity. If you want to employ a diverse workforce, if you work with bilingual workers, but also understanding your customers if they come from different cultures, active listening, choice making, empathy, etc. And you can find that information on the NDIS website, and it is free of charge. If you're looking for other specific training, just you're very welcome to contact us, and we can give you some hints and some advice. Also, CBB is able to do training, so if you need better understanding of the NDIS, please get in touch. We are able to provide training. Just get in touch. And our contact is on the website.
So Ellen has previously provided some training for organisations that really just wanted to understand the NDIS more and see what the business opportunities were for them. So that's definitely something that we're able to help with.
Absolutely. Okay, I've got a question for you, Jane. Does our board also need to complete this training?
Okay, well, that's an interesting one. So according to the rules, anyone in a risk assessed role is considered an NDIS key worker, and that includes key personnel, including board members. The NDIS Commission website isn't very clear about who should complete it, and the name work orientation module does imply that it's for frontline workers, but your board does need to understand the NDIS Code of Conduct and their obligations under the NDIS standards. So they should complete relevant training. So as part of our NDIS Success Programme, we have 2 webinars that are governance webinars, so they're for board members. I present one of them, and Andrew Ellis, who's one of our other consultants, presents the other one. So if you've registered for the programme, you will automatically get registered for those 2 governance webinars. Alternatively, you can access them through the NDIS Success tab on our website, and those webinars will be available, first one on the 3rd of November and the second one on the 17th. So your board, we would suggest that your board watches those. And again, it's a good idea to make sure there's a record of their training for your audit as evidence of your ongoing development. And we really developed that because in the work that we've done around the NDIS previously, we saw that leadership teams were really needing to try and engage their boards in understanding the market. So we set that up to provide boards a good overview of how the NDIS works. So the next question we received by email, we're planning to register and we need to undergo the certification pathway. Can you give us a bit more information about where you can find out what qualifications are required for registration through certification?
That is a very interesting question, and a question which comes up very often because there's actually no information about this. And the auditors should actually use their professional judgment when they audit providers in terms of the professional requirements. And for that judgment, they should also consider the size of the organisation, the location and the scope of the services. From our observation, the auditors actually apply the information provided for the verification pathway because there is an information published on the NDIS Commission website about the verification pathway. So if you are a provider undergoing the certification pathway, please have a look at the documentation about the verification pathway and look at the professional requirements, because this is actually what the auditors use to base their judgment on. Also, the NDIS price guide actually gives a bit of information for some professions, not for all, but for instance, for support coordination. The support coordination, you can't find anything, but for specialist support coordination, there's actually some more detailed information what the requirements are for specialist support coordinator. So please read the NDIS price guide carefully, and you may find some additional information.
Great, thanks, Helen. Now this one we get all the time.
Yes.
How much will it cost to register as an NDIS provider?
Yes, good question. Very good question. Registration as such is free of charge, doesn't cost you anything. However, what costs is the audit? You have to engage an auditor, and it is your responsibility to engage an auditor, and you have to pay for the audit. And of course, the cost of the audit depends on what pathway or what registration groups you're choosing and how many registration groups you're choosing. Of course, the verification process is way cheaper because it's only a desktop audit. So, audits can start around the $1,000 mark. It's worthwhile to get several quotes, as I've mentioned in the webinar. But, it's sort of the $1,000 mark, and this is only due every 3 years. However, if you go through the certification audit, you have a 2-step audit. One is the desktop audit, and the other one is the site audit. And of course, this is going to be way more expensive. Starts at about 4,500-ish, but really depends how many outlets you have, how many participants, because the auditor will have to interview people. So the more participants, of course, the more expensive it is gonna be. Yes, so when you do your application, be really, be clear how many participants you have now. So don't go too far into the future because that will only increase the cost of your audit. Also, choose your registration group carefully because, for instance, if you go for a high intensity module, of course the audit is going to be more expensive because, for instance, for the high intensity module, you're going to need a nurse to come to attend the audit. And having a nurse on site will be way more expensive for the audit. So when you apply for your registration, or if you're doing the re-registration, be really careful about the information you provide because that will really, really define how much you're going to have to pay. Worthwhile to ask other providers, how much they paid. Also worthwhile to get different quotes. If you're a remote provider, or if you have still COVID restrictions, audit can be done remotely, but not always. These are exceptions for the time being. So there's a way to get audited even at the moment. But as such, if you're undergoing certification, it is a site visit is better. And in the future, you will have site audits.
And I think that point about being really thoughtful about your registration groups and your size is really important. We know that certainly in the early days, before people had to have audits to be registered, people tended to register for anything that they thought might be interesting. And, obviously the costs now associated with that. So I think people are being really much more thoughtful around which groups they're registered for.
Also, I think I forgot to mention, the certification, you have an 18-month audit again, and then one again in 3 years, and of course this is adding to the cost. And when you get a quote for your service, you should question: is this also for the midterm audit, or what is actually going to be the cost for the midterm audit?
Great, thanks, Helen.
So I have a question for you, also a very common question. How can we find the best auditor for us?
So, you've already talked about getting a couple of quotes. Price is obviously a factor that organisations will want to consider, but you also really think about the auditor that suits your organisation, because ideally you want to build a long-term relationship with someone. So, just as with your finance audit, you want someone that's going to give you feedback, that's going to kind of make suggestions around how you can improve, and certainly if they're identifying areas for development, give you some suggestions around the kind of things that you need to do in order to reach the required standards. I think the other thing, when you talked a bit earlier about with the training, having training available around for your staff around things like cultural awareness, if you're working remotely, or if you're working with Aboriginal people, or with people with English, don't have English as their first language, or with people that have some other type of communication challenge, and your audit is going to involve the auditor interviewing your customers, I think it's really important that you have someone that can demonstrate they understand how to work with that client group in a sensitive and effective way. So looking at their previous experience and any specialist skills they might have, I think it's really important.
You can actually request a CV.
Exactly. Get the CV, get the background in terms of what they've been doing. The remote issue is also a challenge. So obviously, if you're in a remote area, it's worth checking if you're going to have to pay for travel costs for somebody to come and do that audit with you. And then it might be worth thinking about, are there other providers in your area, and can you schedule audits at the same time and see if you can use the same auditor so you can split some of the travel costs. Obviously some logistics involved in that, but that might be a way that you can look at managing some of the fees around it. The other thing is obviously just to ask for recommendations. So, I know a number of our clients will talk to each other about their audit experience and just share, how they felt they got on with their auditor, how well prepared they were, how well they communicated within the organisation and with customers, what kind of feedback they got. So do get some input from your colleagues and friends within the sector to see if they've got any recommendations about people that you feel will be a good fit for your organisation. And if you do identify a specific auditor within a business, an audit business that you want to work with, you can accept the quotation on the condition that you'll be working with that auditor.
Yep, definitely.
Okay.
And there are some auditors who are a bit longer in the market now, and some are fairly new. So please, just ask. Have you done that before, or is it, you're just starting out? Might be factor as well.
Yeah, absolutely.
So I've got another question for you, Jane. Where could we get help with developing our policies and procedures?
Yeah, we get asked this one a lot. So the NDIS quality and safeguard rules are very descriptive. And if you go through the rules in detail and the quality standards that apply to your registration groups, you can from that build out what you need in terms of your own policies and procedures. But it takes time.
A lot of time.
You know, and obviously within CBB, we look through that stuff regularly. We're familiar with it. We know some of our client organisations have a quality person directly within their business to manage all of that kind of stuff. So often it takes a lot of, you know, experience and patience and some specialist skills to kind of interpret how you translate those into policies and procedures. So there's some alternative options to doing it yourself or doing it all yourself. There are some quality and safeguard platforms that have generic policies and procedures, and generally you pay for those on a subscription basis. They can be quite reasonably priced, and certainly if you're a sole trader delivering a low risk service, that might be sufficient to get you through a verification audit. And if you are a more complex organisation, they can also give you a really good basis on which to establish your own policies and procedures. And we do recommend that if you go for that generic route, you really do try and customise to your service and to your organisation. So, you know, they're a tool for you to ensure that your services are safe and to a high quality, but auditors will be looking at whether your policies and procedures are proportionate and appropriate to your organisation and the services you provide. So, you know, you can't just put a standard policy in there and expect that that's going to always be sufficient. Obviously, we've got some providers that will need to comply with several standards. So it could be that you're providing disability services and aged care services, very common for kind of home care providers. Or it could be that you're following an ISO standard or something like that. So National Disability Services, I mentioned them earlier, are the peak body for disability services, and they have a quality portal that has templates that you can adjust. So you know, something that you can adapt for you, which cross-links the standards from different areas. So that gives you checklists and tools to help you prepare for your audit. And the cost for that depends on the size of your organisation, but you can get a 2-week free trial. It is quite complex, so if you're a new provider and you're small, it might be more than you need. So, you know, just think about what's fit for purpose. It can be quite confusing. Think about what's fit for purpose for you. And then obviously the other alternative is that you work directly with an experienced consultant. So you commission a consultant to help you prepare some unique policies and procedures for your organisation. And don't forget that your documents need to be accessible to your clients and to their family members. So you need to have documents available either in easy read policies or similar that really help people to understand how to lodge a complaint, how to report an incident. And those should be available to everyone visiting your facilities, family members of your clients, as well as your clients themselves. So, you know, it's important to publish that information on your website and in your facilities as well. Okay. One for you, Ellen. So you mentioned the midterm audit earlier when we were talking about certification. You know, a number of organisations are kind of getting those looming on the horizon.
Yes, especially in SA.
Yeah. So what can they expect?
Yes, we haven't got a whole lot of insight yet what's happening in the midterm audit, but we expect that the auditor will actually look at the non-conformances of your big audit, because you had now 18 months to rectify those. So they will look for evidence how you dealt with those minor non-conformances. And what the auditor most certainly will look for is that you have an internal audit schedule and that you are doing internal audits, that you're recording your findings from the internal audits, and that you have a continuous improvement program. So whatever you come up with the findings you have in your internal audits, have a plan in how you will actually rectify it, and what are you actually doing to improve your systems and your practices. I think the highest priority will be your incidents system, your compliance system and your risk management approach. Often we see that providers have a risk management matrix or, not nicely developed, but it's actually empty. So this actually should be a live document, and providers should actually regularly look at it and update, and actually you should see that they're actually mitigating their risks. Something we actually expect as well to be happening in those midterms audits is your response to COVID-19, of course. Have all your workers completed their infection control training? What are you doing in the business to prevent infection and the spread of infection? What are you doing if someone gets infected, one of your workers or one of your participants? So you will need a business continuity plan, and you will need to demonstrate how you will continue supports in case a sickness occurs in your organisation.
Great, thanks, Alan. And I think this is our last question for the day. So we mentioned that we've got some providers that are providing both aged care and disability services, and that could be home care type services, but also in residential facilities. So this issue about people with disabilities being in aged care residential homes. There's some changes coming up in December.
Yes.
Could you perhaps provide a bit of an overview of what that means?
So residential aged care facilities that are supporting NDIS participants, they have to comply with the aged care regulation and the NDIS code of conduct. And so far they were exempt from registration with the NDIS Commission, but that is sadly coming to an end. And as of the 1st of December, those residential aged care facilities also have to register with the NDIS Commission and will have to undergo an audit. The standards for those facilities, we don't know whether they actually have to comply with a full set. We hope that there actually will be in simplified standards for those residential facilities. We don't know what they're going to look like, but we would expect that they have to get audited on their compliance, incident, again, risk management approach. And the behaviour support, how they applying this behaviour support regulations. The NDIS Commission is actually funding AXA to provide better help to the sector to manage this transition. So there should be some materials coming out fairly soon, which should give aged care providers a system to register with the NDIS Commission. And as I said, I hope there will be some additional help available for aged care facilities.
And AXA is the Asian Community Services Australia, so it's the peak body for not-for-profit aged care providers. Okay. Thanks, Alan.
Thank you.
And thanks to those of you that submitted your questions. We hope that the information we've provided today has been very useful. And we encourage you, if you've still got questions, to post them in the Facebook group or email us if anything's unclear. You can also book a 30-minute free consult with one of our consultants if you'd rather just have a one-to-one chat to deal with your question. And we have now opened applications for the one-to-one support under the NDIS Success Programme. So we're currently working with 8 organisations that successfully applied for one-to-one support in round 1, and we have applications for one-to-one support for round 2 open, so another 8 places for organisations who work with our consultants over a 6-month period to help you to either develop a new NDIS service, to expand an existing service or grow an existing service, or build out, improve what you're doing currently within the NDIS space. So the organisations that we're working with at the moment are looking, for example, at regional growth. They are looking at growing existing services. They're looking at developing some new services and some quite innovative ideas that we're working with at the moment.
And we have some providers who are actually not NDIS providers yet, and who are just starting
out. So if you think that's for you, then please do go to our website and apply there. Applications are open until the 30th of October.
And it's free support, free consulting support.
Free consulting support. So thank you for watching. Thank you, Ellen, for answering those questions. Our next webinar on strategies for success will be available from the 29th of September and will be presented by Andrew Ellis, who you've seen some of the earlier webinars in the series. Thank you.
Bye.